Hey guys, so today I'm talking about breast implant profile. This is probably one of the most least understood aspects of breast implant surgery. On the table in front of me, I have 4 different implants. As you can see, they all look very, very different, but the thing is, they're the exact same size. They're all 300 cc's. What we're seeing here is the difference in profile. So most people think that when you say high profile, ultra high or extra high profile, you're talking about how high on your chest the implant sits, when that's not really true at all. The profile really refers to the ratio between the base width and the projection. Let's have a look at these implants here. Again, all 300 cc's, you have low profile, moderate profile, high profile, extra high profile. So we'll look at each one individually and work out why is it that profile? Why do we call it that? Starting here with the low profile, it's a lot wider and flatter than the others, as you can see. So a low profile implant is good for filling the base of the breast, but it doesn't give you a lot of projection. Moving on to moderate profile, again, if you have a slightly narrower chest but still want a small volume implant, you can put in a moderate profile. It's a little bit more projected than the low, but not quite as projected as the high and the extra high. So when I do implant sizing with a patient, generally I go towards a high profile as our default. Let's say your breast width is quite wide and you want a small volume implant. I then start to steer towards moderate or low, purely because the priority is to fill the breast width. You don't want an implant that's too narrow and sticks out a lot because that just looks unnatural. So first priority, breast width. Second priority, projection. Now let's say I'm sizing again and we start with a high profile implant and the patient wants higher and higher volume. As we go up in high profile, the implants get wider in addition to getting more projected. Now at some point we're gonna get to a point where it becomes too wide for the patient's chest. And so if they wanna go up, continue going up in volume, we'll go into ultra high or extra high, where the base width is a little bit more narrow, but we get our volume by going this way. So in terms of maximum size, ultimately, yes, there is a maximum size that patients can have based on their breast width. I'll use an example of a patient who has a 13 centimeter width here, and that is 13 centimeters where we can sit an implant on. We don't want to put in an implant that's 14 centimeters because we're going to end up going over that and end up in the armpit. So if you want to know the maximum size that you can have as a patient, you look at your breast width and you look at the ultra high profile because that's how we can get our maximum volume in. And we need a base width that falls in under that 13 centimeters, generally around 12 centimeters, because we do need to give a little bit of room for the implant to sit in. We can't go directly to 13 centimeters. You have to think about skin, fat, and other tissue that's there. So the main risk of going too wide with an implant is having the implants sit very far out under the armpit and also pushing this way and connecting the breast. So that's what we call symastia or uniboob. On the other hand, picking an implant that's too narrow will result in a very unnatural look where the gap between your breast or your cleavage is very wide. And another thing that can happen is if you pick an implant that's too narrow but try to give yourself very good cleavage, you can end up pushing your nipples laterally. And so if you've ever seen patients that have nipples pointing in opposite directions, it's usually because an implant that was too narrow was placed too close together in the center. So there are multiple things to think about when we're thinking about achieving cleavage. The first thing is your anatomical gap, or the space that you were given. That's where your muscle, your pec muscle edge, joins your sternum, which is your breastbone. Now that space is fixed. There's only so close we can get. If I try to go too close by cutting through the muscle, there's a very high chance of connecting the breasts and resulting in symastia or uniboob. If our space is within the average, so about 1 centimeter between the breasts, we can then consider what implant to pick in order to achieve the best cleavage. And that's going to be something that fills the breast width adequately. Now, in addition to thinking about the space that you have already, we need to think about nipple placement. Let's say your nipples are right in the center of your breast. We can find an implant that fills the width and centers behind the nipple. That will give us as close cleavage as possible, whilst at the same time keeping behind the nipple. Now let's say your nipples are very far to the side, or lateral nipples. We always want to center the implant behind the nipple. However, if we do that and we pick an implant that's too narrow, we're going to have a very wide gap. So there are a number of things we can do there. Either we can do an additional procedure to move the nipples in, or we can pick an implant that's a lot wider to sit under the nipple. The problem there arises that we might end up too far into the armpit. So quite a lot of considerations when we're trying to achieve cleavage. We can't just look at cleavage as a singular entity and just do that. We need to take into account all the other parts of your anatomy. All right, guys, so that was implant profiles. Any other questions? Anything you didn't understand? Let us know in the comments and we'll get back to you.